Question 1. During the evaluation of a patient's discharge process, which documentation approach best reflects adherence to best practices for patient education in the emergency department? Option A. Noting that patient verbalized understanding of discharge instructions without detailing the content of the education or the assessment method. Option B. Omitting any specific documentation related to patient education, assuming it was implicitly provided during the encounter. Option C. Documenting the specific discharge instructions provided, the teaching methods utilized, e.g., verbal, written materials, demonstration, and the patient's demonstrated understanding of the information, including any questions asked and answered. Option D. Recording a general statement that patient received discharge education without further elaboration. The correct answer is C. Documenting the specific discharge instructions provided, the teaching methods utilized, e.g., verbal, written materials, demonstration, and the patient's demonstrated understanding of the information, including any questions asked and answered. Explanation. Scenario analysis. This scenario is professionally challenging because effective patient education is a cornerstone of safe and quality emergency nursing care, directly impacting patient outcomes and adherence to treatment plans. In the fast-paced emergency department environment, ensuring that patients understand their discharge instructions, medication regimens, and follow-up care is often difficult. The challenge lies in balancing the urgency of patient disposition with the critical need for clear, comprehensive, and documented education, especially when patients may be anxious, in pain, or experiencing cognitive impairment. The nurse must accurately assess the patient's understanding and tailor the education accordingly, then meticulously document this process to meet regulatory requirements and protect both the patient and the healthcare provider. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core principles of patient-centered care and regulatory compliance. Thoroughly documenting the patient's understanding. The methods used to convey information, e.g., verbal, written, demonstration, and any barriers encountered, e.g., language comprehension, ensures a complete and accurate record. This documentation serves as evidence that the nurse fulfilled their educational responsibilities, supports continuity of care, and is essential for meeting the documentation standards mandated by regulatory bodies such as the Emergency Nurses Association, (ENA), guidelines and relevant state nursing practice acts, which emphasize the importance of patient education and its accurate recording. Incorrect approaches analysis. Failing to document the patient's understanding of discharge instructions is a significant regulatory and ethical failure. It implies that the education may not have occurred or was not effective, leaving the patient vulnerable to non-adherence and potential adverse events. This omission violates the principle of accountability in nursing practice and can lead to legal ramifications if a patient experiences harm due to a lack of understanding. It also fails to meet the documentation requirements of professional nursing standards. Documenting only that patient education was provided, without detailing the content, method, or assessment of understanding is insufficient. This generic entry does not demonstrate that the education was tailored to the individual patient's needs or that the patient comprehended the information. It is a superficial documentation that does not meet the depth of detail required by professional nursing standards and can be challenged as inadequate in a legal or regulatory review. Documenting that the patient verbalized understanding without further elaboration on what was understood or how understanding was assessed is also problematic. While verbalization is a component of assessment, it does not guarantee true comprehension. A more robust documentation would include specific topics covered and confirmation of understanding beyond a simple verbal assent, especially for complex instructions. This approach risks overstating the patient's actual comprehension and may not fully satisfy the documentation requirements for effective patient education. Professional reasoning. Professionals should approach patient education documentation by first assessing the patient's readiness and ability to learn. This involves considering their cognitive state, emotional condition, cultural background, and any language barriers. The education should then be delivered using methods appropriate to the patient's needs, such as plain language, visual aids, or teach-back techniques. Documentation should reflect this individualized approach, detailing the specific information conveyed, the teaching methods employed, the patient's response and demonstrated understanding, and any follow-up instructions or resources provided. This comprehensive approach ensures patient safety, promotes adherence and fulfills professional and regulatory obligations. Question 2. Process analysis reveals a patient in the emergency department is refusing a critical intervention ordered by the physician, stating they don't want any more needles. The nurse observes the patient appears anxious but otherwise alert and oriented. The physician is busy with another critical patient. What is the most appropriate initial nursing action to uphold patient advocacy while ensuring appropriate care? Option A. Engage the patient in a calm, private conversation to explore the specific reasons for their refusal, assess their understanding of the intervention and its implications, and determine if their anxiety is a barrier to decision-making. Option B. Assume the patient lacks capacity due to their anxiety and the emergency situation, and proceed with the intervention after consulting with the physician. Option C. Administer the ordered intervention as the physician's order takes precedence in an emergency, and document the patient's resistance. Option D. Document the patient's refusal as per protocol and inform the physician immediately, allowing the physician to address the patient directly. The correct answer is A. Engage the patient in a calm, private conversation to explore the specific reasons for their refusal, assess their understanding of the intervention and its implications, and determine if their anxiety is a barrier to decision-making. Explanation. Scenario analysis. This scenario is professionally challenging because it pits the immediate needs and expressed wishes of a vulnerable patient against the perceived best interests and established protocols of the healthcare team. The emergency department environment is inherently chaotic, often leading to time pressures that can impede thorough communication and patient-centered decision-making. The nurse must navigate potential conflicts between the patient's autonomy and the team's clinical judgment, all while ensuring the patient receives appropriate care and their rights are upheld. Correct approach analysis. The correct approach prioritizes direct, respectful communication with the patient to understand the underlying reasons for their refusal. This aligns with the ethical principle of patient autonomy, which is a cornerstone of healthcare practice. In the U.S., this is reinforced by regulations such as the Patient Self-Determination Act, which mandates that healthcare facilities inform patients of their rights to make decisions about their medical care, including the right to refuse treatment. The nurse's role as a patient advocate requires them to actively listen, assess for capacity, and explore alternatives or barriers to understanding, rather than immediately overriding the patient's wishes. This approach ensures the patient's values and preferences are respected, fostering trust and potentially leading to a more informed and acceptable treatment plan. Incorrect approaches analysis. One incorrect approach involves immediately overriding the patient's refusal based solely on the physician's order. This fails to uphold patient autonomy and violates the ethical obligation to respect a competent patient's right to refuse treatment. It bypasses the crucial step of assessing the patient's understanding and capacity, and it undermines the nurse's role as an advocate. Ethically, this can be seen as paternalistic and disrespectful. Legally, it could expose the healthcare team to liability for battery if treatment is administered against a competent patient's will. Another incorrect approach is to document the refusal without further investigation or attempting to understand the patient's rationale. While documentation is essential, simply recording the refusal without engaging the patient is a failure of advocacy. It neglects the nurse's responsibility to ensure the patient is making an informed decision and to explore any reversible factors contributing to their refusal, such as fear, misunderstanding, or pain. This passive approach can lead to suboptimal care and does not fulfill the nurse's ethical duty to promote patient well-being and informed consent. A third incorrect approach is to dismiss the patient's concerns as irrational or a result of their condition without a formal capacity assessment. While altered mental status can affect decision-making capacity, a presumption of incapacity should not be made without a structured evaluation. The nurse's role is to facilitate this assessment and advocate for the patient's right to be presumed competent until proven otherwise. Dismissing concerns without due process is a failure of advocacy and can lead to the imposition of unwanted medical interventions. Professional reasoning. When faced with a patient refusing treatment, the professional decision-making process should begin with a thorough assessment of the patient's capacity to make the decision. This involves evaluating their ability to understand the information presented, appreciate the consequences of their decision, and communicate their choice. If capacity is present, the nurse must then engage in open and honest communication, exploring the patient's reasons for refusal, addressing their concerns, and providing clear, understandable information about the risks and benefits of treatment and the consequences of refusal. The nurse should also involve the healthcare team, including the physician, to ensure a collaborative approach that respects the patient's autonomy while ensuring their safety and well-being. If capacity is questionable, the nurse must advocate for a formal capacity assessment and involve appropriate resources, such as ethics committees or legal counsel, as needed. Question 3. Consider a scenario where a patient in the emergency department suddenly becomes unresponsive and is not breathing normally. The nurse immediately calls for assistance and begins to assess the patient. Which of the following actions best reflects adherence to basic life support, BLS, principles for healthcare providers in this critical situation? Option A. Spend time attempting to palpate a pulse and assess pupil size and reactivity before initiating any other interventions. Option B. Administer intravenous epinephrine immediately while waiting for the crash cart to arrive. Option C. Focus on securing an airway with an advanced device before starting chest compressions. Option D. Immediately begin high-quality chest compressions at a rate of 100-120 per minute and prepare the automated external defibrillator ED for potential use. The correct answer is D. Immediately begin high-quality chest compressions at a rate of 100-120 per minute and prepare the automated external defibrillator ED for potential use. Explanation. This scenario is professionally challenging due to the critical nature of basic life support, BLS, and the immediate need for effective intervention while adhering to established protocols. The nurse must balance the urgency of the situation with the requirement for precise, evidence-based actions. The correct approach, which involves initiating high-quality chest compressions and preparing for defibrillation, represents best professional practice because it directly aligns with current BLS guidelines, such as those established by the American Heart Association, AHA, for healthcare providers. These guidelines emphasize early and effective cardiopulmonary resuscitation, CPR, and prompt defibrillation for shockable rhythms as the cornerstones of successful resuscitation. Adherence to these protocols is a regulatory expectation for certified emergency nurses, ensuring a standardized and effective response to cardiac arrest. An incorrect approach that delays chest compressions to first confirm a pulse or assess pupil reactivity would be a regulatory and ethical failure. Current BLS guidelines prioritize immediate chest compressions for unresponsive, apneic individuals suspected of cardiac arrest, as pulse checks can be unreliable and time-consuming, delaying life-saving interventions. Failure to initiate compressions promptly directly violates the principle of acting in the patient's best interest by withholding potentially life-saving treatment. Another incorrect approach, such as administering medications before initiating CPR and defibrillation, represents a significant deviation from established BLS algorithms. While medications are part of advanced cardiac life support, their administration is typically secondary to high-quality CPR and defibrillation in the initial stages of cardiac arrest management. Delaying these foundational interventions for medication administration would be a failure to adhere to evidence-based practice and could negatively impact patient outcomes, potentially constituting negligence. The professional decision-making process in such situations should involve rapid assessment of the patient's responsiveness and breathing, immediate activation of the emergency response system, and prompt initiation of BLS according to established protocols. This framework prioritizes the most impactful interventions first, ensuring that time-critical actions are not delayed by less critical assessments or interventions. Question 4. The review process indicates a discrepancy in the initial management of a critically ill patient presenting with altered mental status and visible external bleeding. One nurse initiated a detailed history-taking and began a head-to-toe physical examination, while another immediately focused on controlling the external bleeding and assessing the patient's airway and breathing. A third nurse began administering pain medication based on the patient's reported discomfort, which approach most closely aligns with the established principles of emergency nursing assessment and patient stabilization. Option A. Immediately controlling external bleeding and assessing airway and breathing. Option B. Initiating a detailed history-taking and beginning a head-to-toe physical examination. Option C. Administering pain medication based on the patient's reported discomfort. Option D. Focusing on the patient's chief complaint of altered mental status without further immediate assessment. The correct answer is A. immediately controlling external bleeding and assessing airway and breathing. Explanation: this scenario presents a common challenge in emergency nursing, prioritizing interventions when faced with a patient exhibiting multiple, potentially life-threatening issues. The core of the challenge lies in the dynamic nature of emergency care, where rapid assessment and decisive action are paramount. A nurse must not only identify all problems, but also determine the immediate threats to life and limb, applying a systematic approach to ensure the most critical needs are addressed first. This requires a deep understanding of physiological priorities and the ability to adapt the assessment based on evolving patient status. The correct approach represents best professional practice by adhering to the fundamental principles of emergency nursing assessment, specifically the ABDE, airway, breathing, circulation, disability, exposure framework, which is a cornerstone of emergency care protocols. This systematic head-to-toe approach ensures that immediate life threats are identified and managed before proceeding to less critical issues. Following this established protocol aligns with professional standards of care, patient safety guidelines, and regulatory requirements for competent emergency nursing practice, ensuring a structured and evidence-based response. An incorrect approach that focuses solely on a patient's chief complaint without a comprehensive primary survey is professionally unacceptable. This failure to systematically assess ABDE can lead to overlooking critical, underlying issues that pose a more immediate threat to life. For instance, a patient presenting with severe abdominal pain might also have compromised airway or breathing that is not immediately apparent if the primary assessment is bypassed. This constitutes a breach of the standard of care and could be considered negligent, violating ethical obligations to provide safe and effective care. Another incorrect approach that prioritizes a secondary survey before completing the primary survey is equally problematic. The secondary survey is designed to gather more detailed information after immediate life threats have been addressed. Skipping or delaying the primary survey in favor of a secondary one means that critical interventions for airway, breathing, or circulation might be postponed, potentially leading to irreversible harm or death. This demonstrates a lack of understanding of the urgency and hierarchy of needs in emergency care, violating professional accountability and patient advocacy principles. Furthermore, an approach that relies on assumptions about the patient's condition based on their presentation or history without a thorough, systematic assessment is a significant ethical and professional failing. Emergency situations are inherently unpredictable, and assumptions can lead to critical errors in judgment and treatment. Best professional practice dictates a rigorous, objective assessment process that validates or refutes initial impressions. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reassessment. Upon encountering a patient, the nurse must immediately initiate the primary survey ABDE, identifying and managing any life-threatening conditions. Concurrently, they should be gathering brief, relevant history and vital signs. Once the primary survey is complete and the patient is stabilized, the secondary survey can be initiated, followed by ongoing monitoring and reassessment. This iterative process ensures that the patient's needs are continuously evaluated and addressed in order of priority, guided by established emergency care protocols and clinical judgment. Question 5. Which approach would be most appropriate for a certified emergency nurse managing a critically injured patient who presents with absent breath sounds on the left, paradoxical chest wall movement, and hypotension refractory to initial fluid resuscitation? Option A. Proceed with a rapid sequence intubation and mechanical ventilation, followed by chest tube insertion and aggressive fluid and blood product resuscitation. Option B. Administer a bolus of broad-spectrum antibiotics and initiate a computed tomography (CT) scan of the chest and abdomen to identify internal injuries. Option C. Initiate a continuous infusion of vasopressors and closely monitor oxygen saturation while awaiting further diagnostic imaging. Option D. Focus on obtaining a portable chest X-ray and administering pain medication to improve chest wall excursion before reassessing vital signs. The correct answer is A. Proceed with a rapid sequence intubation and mechanical ventilation, followed by chest tube insertion and aggressive fluid and blood product resuscitation. Explanation: this scenario is professionally challenging due to the rapid deterioration of a trauma patient, requiring immediate, evidence-based interventions under pressure. The nurse must balance the need for swift action with adherence to established protocols and ethical considerations. particularly regarding patient autonomy and informed consent when possible. The correct approach represents best professional practice because it aligns with the principles of Advanced Trauma Life Support ADLS, or equivalent National Trauma Resuscitation Guidelines, which are the standard of care in emergency nursing. This approach prioritizes a systematic assessment and intervention sequence, starting with primary survey, UPDE, and immediate life-saving measures, followed by secondary survey and definitive care. It emphasizes continuous reassessment and adaptation of the treatment plan based on the patient's response, reflecting a commitment to patient safety and optimal outcomes, as mandated by nursing practice standards and regulatory bodies governing emergency care. An incorrect approach that delays definitive airway management in favor of less critical interventions fails to adhere to the fundamental principle of securing the airway in a compromised patient, potentially leading to irreversible hypoxia and death. This violates the nursing duty to provide timely and appropriate care. Another incorrect approach that focuses solely on diagnostic imaging before stabilizing the patient's vital signs disregards the immediate life threats identified in the primary survey, contravening established trauma resuscitation priorities and potentially exacerbating the patient's condition. A third incorrect approach that involves administering medications without a clear indication or physician's order, or without understanding their potential impact on the patient's hemodynamic status, represents a significant breach of professional conduct and patient safety protocols, potentially causing harm and violating medication administration guidelines. Professionals should employ a decision-making framework that begins with rapid scene assessment and patient triage, followed by a systematic application of the UPDE approach. This involves continuous critical thinking, anticipating potential complications, and communicating effectively with the trauma team. The framework should also include a commitment to ongoing education and adherence to evidence-based practice guidelines to ensure the highest standard of care is consistently delivered. Question 6. Risk assessment procedures indicate a patient presenting with acute chest pain and shortness of breath requires immediate intervention. The emergency department is experiencing a high patient volume, and the nurse is managing multiple critical cases. Which of the following actions best balances immediate patient care with regulatory compliance for documentation? Option A. Prioritize completing a detailed, written nursing note for the patient's initial presentation and assessment before administering any medications or interventions. Option B. Provide immediate medical interventions as per protocol, and then meticulously document all assessments, interventions, and patient responses as soon as the patient is stabilized and the immediate crisis has passed. Option C. Administer initial interventions and document key actions and observations concisely in the patient's electronic health record in real time or as soon as feasible, while continuing to monitor and manage the patient's condition. Option D. Focus solely on administering medications and treatments, verbally communicating critical information to the physician, and deferring all written documentation until the end of the shift. The correct answer is B. Provide immediate medical interventions as per protocol, and then meticulously document all assessments, interventions, and patient responses as soon as the patient is stabilized and the immediate crisis has passed. Explanation. This scenario presents a common challenge in emergency nursing, balancing immediate patient needs with the requirement for accurate and timely documentation, all within a high-pressure environment. The professional challenge lies in prioritizing critical interventions while ensuring that the legal and regulatory requirements for patient care documentation are met. Failure to document accurately and promptly can have significant legal and clinical ramifications, impacting patient safety, continuity of care, and potential reimbursement. The correct approach represents best professional practice because it integrates essential nursing actions with the fundamental regulatory requirement for documentation. Adhering to established protocols for charting, even during a critical event, ensures that a legal record of the patient's condition, interventions, and outcomes is maintained. This aligns with the principles of professional accountability and the legal standards of care expected of emergency nurses. Specific regulatory frameworks, such as those governing healthcare records and professional conduct, mandate accurate and contemporaneous documentation. An incorrect approach that prioritizes immediate patient care over all forms of documentation, without a plan for subsequent charting, fails to meet these regulatory mandates. This can lead to incomplete medical records, which are legally indefensible and can hinder subsequent care. Another incorrect approach, focusing solely on documentation without addressing the immediate life-threatening condition, violates the fundamental ethical and professional obligation to provide timely and appropriate patient care. This could result in patient harm and a breach of the standard of care. A third incorrect approach, relying on verbal communication alone without written documentation, is insufficient as it lacks the permanence and legal weight required for official patient records. Professionals should employ a decision-making framework that involves rapid assessment of the patient's acuity, identification of immediate life-saving interventions, and simultaneous or near-simultaneous initiation of documentation. This often involves utilizing standardized charting templates, employing shorthand where appropriate and understood, and delegating non-critical charting tasks if feasible. The key is to maintain a continuous, albeit potentially brief, record of critical events and interventions as they occur, with a commitment to completing a comprehensive chart as soon as the immediate crisis allows. Question 7. Strategic planning requires a certified emergency nurse to anticipate and manage potential life-threatening conditions in a severely injured patient. Given a patient arriving with multiple blunt force trauma following a motor vehicle collision, which of the following approaches best reflects the immediate priorities for assessment and management according to established trauma protocols? Option A. Administer pain medication to alleviate the patient's discomfort while awaiting further diagnostic imaging. Option B. Conduct a rapid primary survey focusing on airway patency, breathing effectiveness, and circulation, addressing any life threats identified before proceeding to secondary assessment. Option C. Prioritize obtaining a portable chest X-ray to rule out pneumothorax while simultaneously administering intravenous fluids. Option D. Immediately initiate a detailed neurological assessment to evaluate for potential head injury. Correct answer is D. Immediately initiate a detailed neurological assessment to evaluate for potential head injury. Explanation. This scenario presents a common challenge in emergency nursing, prioritizing interventions for a critically injured patient with multiple potential life threats. The complexity arises from the need to rapidly assess, identify, and manage conditions that can lead to irreversible damage or death, all while maintaining a systematic approach. The certified emergency nurse, CEN, must demonstrate proficiency in advanced trauma life support principles, integrating knowledge of pathophysiology, anatomy, and evidence-based practice to guide their actions. The pressure of time, limited resources, and the patient's unstable condition necessitate a structured and decisive approach. The correct approach represents best professional practice by adhering to the established principles of advanced trauma life support ATLS, or equivalent national trauma protocols, which are foundational to emergency nursing practice and often mandated by regulatory bodies and professional organizations. This systematic approach, starting with primary survey airway, breathing, circulation, disability, exposure up death, and proceeding to secondary survey and definitive care, ensures that immediate life-threatening injuries are addressed first. This aligns with the ethical obligation to provide competent and timely care, minimizing harm and maximizing the patient's chance of survival and recovery. Adherence to these protocols is often a requirement for maintaining professional licensure and certification, reflecting a commitment to evidence-based, standardized care. An incorrect approach that deviates from the systematic primary survey, such as focusing on a single obvious injury without a comprehensive assessment of airway, breathing, or circulation, represents a significant regulatory and ethical failure. This could lead to overlooking or delaying treatment of a more immediate life threat, violating the nursing standard of care and potentially causing harm. Prioritizing diagnostic imaging over immediate resuscitation efforts when circulation is compromised is another critical failure. This demonstrates a lack of understanding of the urgency of hemorrhagic shock and the immediate need for intervention, which is a direct contravention of established trauma management guidelines and ethical principles of beneficence and non-maleficence. Similarly, neglecting to expose the patient adequately to identify all injuries or failing to consider environmental hazards can lead to misdiagnoses and adverse outcomes, falling short of the professional standard of care. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's presenting complaint and mechanism of injury. This is followed by the systematic application of the primary survey (EPDE), which guides immediate interventions. If the patient remains unstable, re-evaluation of the primary survey is paramount. Once the patient is stabilized, the secondary survey is initiated, followed by definitive management and ongoing monitoring. This structured approach, grounded in established trauma protocols and ethical principles, ensures that critical interventions are not missed and that patient care is delivered in a logical, efficient, and effective manner. Question 8. The investigation demonstrates a patient presenting to the emergency department with acute shortness of breath, wheezing, and increased work of breathing. The nurse's initial assessment reveals diminished breath sounds and a respiratory rate of 32 breaths per minute. Which of the following approaches best reflects current best practice for managing this respiratory emergency? Option A. Administer supplemental oxygen to maintain saturation above 90%, provide a nebulized short-acting beta agonist, and administer intravenous corticosteroids. Option B. Administer intravenous fluids and monitor vital signs closely while awaiting physician orders for further intervention. Option C. Focus on positioning the patient comfortably and providing reassurance, as pharmacological interventions can be delayed until the patient is calmer. Option D. Administer a sedative medication to help the patient relax and reduce anxiety associated with their breathing difficulties. The correct answer is A. Administer supplemental oxygen to maintain saturation above 90%, provide a nebulized short-acting beta agonist, and administer intravenous corticosteroids. Explanation. Scenario analysis. Managing a patient experiencing an acute respiratory emergency like asthma or COPD exacerbation presents significant challenges due to the rapid deterioration potential and the need for immediate, evidence-based interventions. The nurse must accurately assess the severity of the respiratory distress, identify the underlying cause if possible, and initiate appropriate pharmacological and non-pharmacological treatments while continuously monitoring the patient's response. This requires a high level of critical thinking, clinical judgment, and adherence to established protocols to prevent adverse outcomes, including respiratory failure and death. Correct approach analysis. The correct approach prioritizes immediate, evidence-based interventions for respiratory distress, aligning with best practices for emergency nursing care. This includes administering supplemental oxygen to maintain adequate saturation, providing bronchodilators, e.g., short-acting beta agonists, to open airways, and administering corticosteroids to reduce inflammation, as per current emergency nursing guidelines and protocols. Continuous reassessment of the patient's respiratory status, vital signs, and response to treatment is paramount. This approach directly addresses the pathophysiology of asthma and COPD exacerbations, aiming to stabilize the patient and improve gas exchange, thereby upholding the ethical and professional responsibility to provide timely and effective care. Incorrect approaches analysis. An approach that delays or omits the administration of bronchodilators, focusing solely on oxygen therapy, is professionally unacceptable. While oxygen is crucial, it does not address the bronchoconstriction characteristic of these conditions. Failure to administer a primary therapeutic intervention could lead to prolonged respiratory distress and worsening hypoxia, violating the duty of care. An approach that administers sedatives without a clear indication or prior stabilization of the respiratory status is also professionally unacceptable. Sedation in a patient with respiratory compromise can depress respiratory drive, leading to further deterioration and potentially respiratory arrest. This action would represent a significant deviation from safe emergency nursing practice and could be considered negligent. An approach that focuses on non-pharmacological comfort measures alone, without initiating evidence-based medical interventions for respiratory distress, is professionally unacceptable. While comfort is important, it is secondary to addressing the life-threatening physiological derangement. This omission of critical medical treatment would fail to meet the standard of care for a patient with an acute respiratory emergency. Professional reasoning. Emergency nurses must employ a systematic approach to respiratory emergencies. This involves rapid assessment using tools like the ABCs, airway, breathing, circulation, and vital signs, followed by prompt implementation of evidence-based interventions, guided by institutional protocols and professional standards of practice. Continuous monitoring and reevaluation are essential to adapt the treatment plan as the patient's condition changes. Decision-making should be rooted in understanding the pathophysiology of the condition, the mechanism of action of prescribed treatments, and the potential risks and benefits of each intervention. Adherence to these principles ensures patient safety and optimal outcomes. Question 9. Process analysis reveals that a patient in cardiac arrest presents with a documented history of atrial fibrillation and is on amiodarone therapy. The emergency department nurse is preparing to administer the next dose of epinephrine as per ACL's guidelines. Considering the patient's existing amiodarone treatment, what is the most appropriate pharmacological consideration for the nurse at this juncture? Option A. Administer a beta blocker to manage the patient's underlying atrial fibrillation rhythm. Option B. Administer epinephrine as per ACL's protocol, recognizing that amiodarone does not typically contraindicate its use in cardiac arrest. Option C. Administer a calcium channel blocker to improve myocardial contractility. Option D. Hold epinephrine and administer a broad-spectrum antibiotic to address potential underlying infection contributing to arrest. The correct answer is B. Administer epinephrine as per ACL's protocol, recognizing that amiodarone does not typically contraindicate its use in cardiac arrest. Explanation. Scenario analysis. This scenario presents a common but critical challenge in emergency nursing, managing a patient in cardiac arrest with a complex medication history. The nurse must rapidly assess the situation, identify potential drug interactions or contraindications, and administer appropriate resuscitation medications according to established protocols. The urgency of cardiac arrest demands swift, accurate decision-making under immense pressure, where errors can have life-threatening consequences. The patient's pre-existing conditions and medications add layers of complexity, requiring a nuanced understanding of pharmacology beyond basic ACL's guidelines. Correct approach analysis. The correct approach prioritizes a rapid, evidence-based assessment of the patient's cardiac rhythm and the administration of the most appropriate resuscitation medication based on current ACL's guidelines and the patient's known medical history. This involves considering the patient's specific rhythm, e.g., VF/pulseless VT, asystole P, and selecting the drug of choice, e.g., epinephrine, amiodarone, while being mindful of any potential contraindications or interactions suggested by the patient's medication list. This aligns with the certified emergency nurse's responsibility to provide safe, competent, and evidence-based care within the scope of practice and hospital protocols, adhering to the principles of patient advocacy and the duty to provide timely and effective treatment. Incorrect approaches analysis. Administering a broad-spectrum antibiotic without a clear indication of infection or consultation with the physician is a significant regulatory and ethical failure. This deviates from the principle of administering medications only when prescribed and indicated, potentially leading to adverse drug reactions, antibiotic resistance, and a delay in administering life-saving resuscitation drugs. Violates the nurse's duty to provide appropriate and necessary care. Administering a medication known to prolong the QT interval without a specific indication or physician order, especially in a patient with a potential cardiac event, is a dangerous and ethically unsound practice. This could exacerbate an underlying cardiac issue or lead to further arrhythmias, directly contravening the nurse's duty to avoid harm. It represents a failure to apply critical thinking and adhere to safe medication administration principles. Initiating chest compressions without confirming a pulse or appropriate cardiac rhythm is a fundamental error in resuscitation. While speed is essential, a basic assessment of pulse and rhythm is a prerequisite for initiating specific interventions. This demonstrates a lack of adherence to basic life support principles and could lead to unnecessary interventions and potential harm. Professional reasoning. Certified emergency nurses must employ a structured decision-making framework during resuscitation. This involves 1. Rapidly assessing the patient's ABCs, airway, breathing, circulation, and cardiac rhythm. 2. Consulting ACL's algorithms for the specific rhythm identified. 3. Reviewing the patient's available medical history and medication list for potential contraindications or interactions. 4. Collaborating with the physician and other team members to determine the most appropriate medication and dosage. 5. Administering medications safely and accurately, continuously reassessing the patient's response. This systematic approach ensures that care is both timely and evidence-based, minimizing the risk of errors and maximizing the patient's chance of survival. Question 10. Performance analysis shows a busy emergency department receiving multiple patients simultaneously. A 3-year-old child presents with rapid, shallow breathing and is difficult to rouse. A 75-year-old male reports sudden onset of severe chest pain radiating to his left arm and shortness of breath. A 30-year-old pregnant woman in her third trimester states she has experienced abdominal pain for the past hour and is concerned about decreased fetal movement. A 40-year-old male presents with a laceration on his forearm that is actively bleeding but not profusely. Based on these initial presentations, which patient requires immediate, highest priority for assessment and intervention? Option A. The 3-year-old child with rapid, shallow breathing and altered mental status. Option B. The 30-year-old pregnant woman with abdominal pain and decreased fetal movement. Option C. The 40-year-old male with a bleeding forearm laceration. Option D. The 75-year-old male with chest pain and shortness of breath. The correct answer is A. The 3-year-old child with rapid, shallow breathing and altered mental status. Explanation. This scenario presents a common yet complex challenge in emergency nursing triage. Prioritizing care for multiple patients with varying acuity and specific vulnerabilities. Professional challenge lies in accurately assessing and prioritizing a pediatric patient with a potentially life-threatening condition against other patients who may present with more obvious, but less immediately critical, signs of distress. The geriatric patient's presentation requires careful consideration of atypical symptomology and potential comorbidities, while the obstetric patient's condition necessitates rapid evaluation for maternal and fetal well-being. Adherence to established triage protocols, such as the Emergency Severity Index (ESI) or similar validated systems, is paramount. These protocols are designed to ensure that patients with the most critical needs receive immediate attention, regardless of age or specific demographic. The correct approach prioritizes the pediatric patient exhibiting signs of respiratory distress and altered mental status. This aligns with best professional practice and regulatory guidelines for emergency nursing, which mandate the immediate assessment and stabilization of patients with compromised airway, breathing, or circulation, ABC, and altered neurological status. Pediatric patients have unique physiological differences that can lead to rapid deterioration, making early recognition of subtle signs of distress crucial. Regulatory frameworks emphasize the nurse's responsibility to identify and act upon life-threatening conditions promptly, often utilizing a systematic approach to triage that places a high priority on respiratory and neurological compromise. An incorrect approach would be to prioritize the geriatric patient solely based on their age and complaint of chest pain, without a thorough assessment of their airway, breathing, and circulation, or to delay assessment of the obstetric patient who is reporting abdominal pain and decreased fetal movement. Prioritizing the geriatric patient over the pediatric patient with clear signs of respiratory distress and altered mental status will be a failure to adhere to the fundamental principles of emergency triage, which dictates that physiological instability and compromised ABCs take precedence. This could be considered a breach of professional duty of care and potentially violate nursing practice standards that require prompt assessment of life-threatening conditions. Similarly, delaying the obstetric patient's assessment, especially with reported decreased fetal movement, could lead to adverse maternal or fetal outcomes and would represent a failure to recognize a potentially critical obstetric emergency, violating guidelines for obstetric triage. Focusing on the patient with the most vocal complaint or the most easily identifiable symptom without a systematic assessment of acuity would also be a failure of professional judgment and adherence to triage protocols. Professional decision-making in such situations requires a systematic, evidence-based approach. This involves utilizing a validated triage tool, performing rapid primary and secondary surveys, considering the patient's age and specific vulnerabilities, pediatric, geriatric, obstetric, and critically evaluating the potential for rapid deterioration. Continuous reassessment of all patients is also a critical component of effective emergency department management. Question 11. The performance metrics show a consistent trend of delayed initiation of advanced airway management in patients presenting with severe respiratory distress and hemodynamic instability. As a certified emergency nurse, what is the most appropriate immediate action to address this trend and improve patient outcomes? Option A. Advocate for a multidisciplinary review of the current respiratory distress and airway management protocols, focusing on identifying bottlenecks and opportunities for earlier intervention based on updated evidence-based guidelines. Option B. Implement a mandatory checklist for all nurses to complete before considering advanced airway interventions, regardless of patient acuity. Option C. Encourage nurses to rely more heavily on pharmacological sedation to manage patient agitation while awaiting physician assessment for airway management. Option D. Prioritize obtaining a portable chest X-ray for all patients with respiratory distress to confirm the need for airway intervention before any other steps are taken. Correct answer is A. Advocate for a multidisciplinary review of the current respiratory distress and airway management protocols, focusing on identifying bottlenecks and opportunities for earlier intervention based on updated evidence-based guidelines. Explanation: this scenario is professionally challenging because it requires immediate, high-stakes decision-making under pressure, balancing the urgency of patient care with the need for accurate, evidence-based interventions. The certified emergency nurse, CEN, must critically assess the situation, prioritize actions, and ensure adherence to established protocols and guidelines, all while managing potential resource limitations and team dynamics. The core of the challenge lies in interpreting complex patient data and translating it into effective resuscitation strategies that align with current best practices and regulatory expectations for emergency nursing. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment and intervention strategy. This aligns with the fundamental ethical and regulatory obligations of emergency nurses to provide competent, safe, and effective care. Specifically, it emphasizes the importance of a rapid, yet thorough, primary and secondary survey, continuous reassessment, and the judicious application of advanced life support principles as dictated by the patient's evolving condition. This approach is grounded in the principles of patient advocacy and the duty to act in the patient's best interest, as mandated by nursing practice acts and professional standards of care. Adherence to established resuscitation guidelines, such as those from the American Heart Association, AHA, for the U.S. jurisdiction, is a critical component of this best practice, ensuring that interventions are current, evidence-based, and standardized for optimal patient outcomes. An incorrect approach that focuses solely on administering a specific medication without a comprehensive assessment fails to uphold the regulatory requirement for individualized patient care and the ethical principle of non-maleficence. This could lead to inappropriate treatment, adverse drug events, and a delay in addressing the underlying cause of the patient's deterioration. Another incorrect approach that involves delegating critical assessment tasks to less experienced personnel without direct supervision violates the regulatory expectation for nurses to practice within their scope and to ensure appropriate oversight of patient care, potentially compromising patient safety. Furthermore, an approach that delays definitive interventions due to an over-reliance on diagnostic imaging before initiating basic resuscitation steps contravenes the urgency demanded in critical care and resuscitation, potentially leading to irreversible harm and violating the ethical duty to act promptly. Professional decision-making in such situations requires a robust framework that includes rapid situational awareness, systematic assessment, a day approach, critical thinking to identify potential causes of deterioration, knowledge of evidence-based interventions and algorithms, effective communication and teamwork, and continuous reassessment and adaptation of the care plan. This framework ensures that decisions are not only timely, but also clinically sound and ethically defensible, prioritizing patient safety and optimal outcomes within the regulatory landscape. Question 12. Compliance review shows a patient presenting to the emergency department with a severe, life-threatening condition. The patient, who identifies with a specific religious group with distinct end-of-life rituals and beliefs about medical intervention, is expressing significant distress and reluctance towards a necessary surgical procedure, citing their faith. The nurse is aware of the urgency of the situation and the standard protocol for this condition. What is the most appropriate course of action for the emergency nurse in this situation? Option A. Inform the patient that their religious beliefs are not compatible with emergency medical treatment and that they must comply with the standard protocol to receive care. Option B. Contact the patient's religious leader without the patient's explicit consent to seek guidance on how to proceed with the medical intervention. Option C. Proceed with the standard medical protocol immediately, as the life-threatening nature of the condition supersedes any cultural or religious objections. Option D. Gently explain the medical necessity of the procedure, inquire about specific religious concerns that may be influencing their decision, and explore if there are any culturally sensitive modifications to the care plan that can be discussed with the medical team and the patient. The correct answer is D. Gently explain the medical necessity of the procedure. Inquire about specific religious concerns that may be influencing their decision, and explore if there are any culturally sensitive modifications to the care plan that can be discussed with the medical team and the patient. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's deeply held cultural beliefs and the standard medical protocols for emergency care. The nurse must navigate this delicate situation while upholding patient autonomy, ensuring safety, and adhering to ethical and legal obligations. The challenge lies in balancing the immediate need for medical intervention with respect for the patient's cultural identity and potential spiritual practices, which may influence their understanding of illness and treatment. The correct approach represents best professional practice because it prioritizes open communication, active listening, and collaborative decision-making. By seeking to understand the patient's beliefs and involving them in the care plan, the nurse demonstrates cultural competence and respect for patient autonomy, which are fundamental ethical principles in nursing practice. This approach aligns with the ethical guidelines that mandate providing care that is sensitive to a patient's cultural background and values, ensuring that treatment decisions are informed and respected. It also adheres to regulatory frameworks that emphasize patient-centered care and the right to make informed decisions about one's health. An incorrect approach that dismisses or overrides the patient's cultural beliefs without thorough understanding or attempt at accommodation would be ethically and regulatorily unsound. Such an approach would violate the principle of respect for persons and could lead to patient distress, mistrust, and non-adherence to treatment, potentially compromising their well-being. It fails to acknowledge the patient's right to self-determination and could be construed as discriminatory or culturally insensitive, contravening professional standards of care and potentially violating patient rights legislation. Another incorrect approach that involves imposing a specific religious or cultural interpretation onto the patient, rather than seeking to understand their unique beliefs, is also professionally unacceptable. This oversteps the nurse's role and disrespects the patient's individual spiritual or cultural framework. It can lead to a breakdown in the therapeutic relationship and further alienate the patient. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the patient's concerns and beliefs without judgment. Second, seek to understand the specific cultural or religious reasons behind their reluctance or requests. Third, assess the medical urgency and potential risks of delaying or altering treatment. Fourth, explore potential compromises or alternative approaches that can accommodate the patient's beliefs while still ensuring safe and effective care, involving family or cultural liaisons if appropriate and with patient consent. Finally, document all discussions, decisions, and the rationale behind the care plan. Question 13. The monitoring system demonstrates a slight but persistent elevation in the patient's respiratory rate from 18 to 24 breaths per minute over the last hour, with no other significant changes in vital signs or reported symptoms. The certified emergency nurse is assessing the situation. Which of the following represents the most appropriate next step within the scope of practice for a certified emergency nurse? Option A. Perform a focused respiratory assessment, including lung auscultation and oxygen saturation monitoring, and review the patient's medical history for conditions that could contribute to tachypnea. Option B. Notify the physician immediately to report the elevated respiratory rate and request orders for a chest X-ray. Option C. Document the change in respiratory rate and continue to monitor the patient without further intervention, assuming it is within normal variation. Option D. Immediately administer a prescribed bronchodilator, as this elevation in respiratory rate often indicates bronchospasm. The correct answer is A. Perform a focused respiratory assessment, including lung auscultation and oxygen saturation monitoring, and review the patient's medical history for conditions that could contribute to tachypnea. Explanation. Scenario analysis. This scenario presents a common challenge in emergency nursing. A patient exhibiting subtle but potentially serious changes in their condition. The professional challenge lies in accurately interpreting the significance of these changes within the established scope of practice for a certified emergency nurse, CEN, and determining the appropriate, timely intervention. The nurse must balance the need for prompt action with the avoidance of unnecessary alarm or intervention, all while adhering to established protocols and professional standards. This requires a deep understanding of physiological responses, potential disease processes, and the legal and ethical boundaries of their role. Correct approach analysis. The correct approach involves a systematic assessment of the patient's overall status, considering the new vital sign data in conjunction with the patient's presenting complaint, medical history, and any other observed signs or symptoms. This aligns with the CEN scope of practice, which includes the ability to assess, diagnose within nursing scope, and plan care for patients with acute and emergent conditions. The CEN is expected to recognize deviations from normal and initiate appropriate interventions, which may include further diagnostic measures, medication administration, as per protocol or physician's order, or escalation of care. This approach prioritizes patient safety and optimal outcomes by addressing potential deterioration proactively and within the nurse's defined professional responsibilities. Incorrect approaches analysis. One incorrect approach involves solely focusing on the single abnormal vital sign without considering the broader clinical picture. This can lead to overintervention or underintervention, depending on the specific vital sign and the patient's context. It fails to meet the professional standard of holistic patient assessment and can result in unnecessary anxiety for the patient or a missed opportunity to address a critical issue. Another incorrect approach is to delay any action, assuming the change is insignificant or will resolve spontaneously. This directly violates the ethical and professional obligation to monitor patients and intervene when their condition warrants it, potentially leading to adverse patient outcomes and a breach of the standard of care. Finally, immediately initiating advanced interventions without a thorough assessment or consultation. If such interventions fall outside the CEN's independent scope of practice or established protocols, would also be an inappropriate response. This could lead to patient harm, resource misuse, and a violation of professional boundaries. Professional reasoning. Certified emergency nurses must employ a structured decision-making process when faced with changing patient conditions. This process typically involves 1. Initial assessment, gathering baseline data and understanding the patient's presenting problem. 2. Ongoing monitoring, continuously observing the patient for changes in their condition. 3. Data interpretation, analyzing collected data, vital signs, symptoms, patient reports, within the context of the patient's history and known pathophysiology. 4. Clinical judgment, applying knowledge and experience to determine the significance of observed changes. 5. Intervention, implementing appropriate nursing actions, which may include independent nursing interventions, collaborative interventions, or escalation of care. 6. Reassessment, evaluating the effectiveness of interventions and continuing the cycle of monitoring and assessment. This systematic approach ensures that care is evidence-based, patient-centered, and within the legal and ethical framework of emergency nursing practice. Question 14. Implementation of a life-saving intervention for a patient presenting with acute respiratory distress, who is verbally refusing the procedure but appears disoriented and unable to articulate their reasoning, presents an ethical and legal dilemma. The patient's next of kin is reportedly out of state and unreachable at this moment. What is the most appropriate immediate course of action for the emergency nurse? Option A. Proceed with the life-saving intervention immediately, as the patient's refusal is clearly not informed due to their disorientation and the emergent nature of their condition. Option B. Delay the intervention until a family member, even if out of state, can be contacted and provide consent, to avoid any potential legal ramifications. Option C. Administer a sedative to calm the patient and facilitate the procedure, as their resistance is likely due to their confusion and distress. Option D. Perform a rapid assessment of the patient's capacity to consent. If capacity is lacking, attempt to identify and contact a legally authorized surrogate decision maker. If none is immediately available and the situation is emergent, proceed with the life-saving intervention while documenting all efforts and rationale. The correct answer is D. Perform a rapid assessment of the patient's capacity to consent. If capacity is lacking, attempt to identify and contact a legally authorized surrogate decision maker. If none is immediately available and the situation is emergent, proceed with the life-saving intervention while documenting all efforts and rationale. Explanation. Scenario analysis. This scenario presents a significant ethical and legal challenge due to the conflict between a patient's stated wishes, their apparent inability to consent, and the potential for harm. Emergency nurses must navigate the complex legal and ethical landscape of patient autonomy versus the duty to protect life, especially when capacity is in question. The urgency of the emergency setting further complicates decision-making, demanding rapid yet ethically sound judgment. Correct approach analysis, prioritizing a rapid assessment of the patient's capacity to consent, is paramount. If the patient is deemed to lack capacity, the next step is to seek consent from a legally authorized surrogate decision-maker, if one is readily available and identifiable. This approach upholds the ethical principle of beneficence, acting in the patient's best interest, while respecting the legal framework for consent in incapacitated patients. It aligns with the Emergency Nurses Association (ENA) Code of Ethics and relevant state laws regarding informed consent and surrogate decision-making, ensuring that care is provided in accordance with the patient's presumed wishes or best interests when they cannot express them. Incorrect approaches analysis, proceeding with the invasive procedure without attempting to assess capacity or identify a surrogate decision-maker, violates the fundamental legal and ethical requirement for informed consent. This disregards the patient's right to self-determination and could lead to legal repercussions for battery, delaying the procedure indefinitely to locate a distant family member. When the patient's condition is deteriorating and a surrogate is not immediately available, could be considered a failure to provide timely and necessary care, potentially breaching the duty to act in the patient's best interest and leading to adverse outcomes. This also fails to acknowledge the legal provisions for emergency care when consent cannot be obtained. Administering a sedative against the patient's verbal resistance, even if they appear confused, without a thorough capacity assessment or a clear indication of immediate danger to themselves or others, could be construed as a violation of their right to refuse treatment and potentially assault. While sedation might be necessary for patient safety, the process must be ethically and legally sound. Professional reasoning. In emergency situations where a patient's capacity is questionable, the professional decision-making process should involve a rapid, yet thorough, assessment of mental status. If capacity is lacking, the immediate priority is to identify and involve a legally authorized surrogate. If no surrogate is immediately available, and the situation is life-threatening or poses a significant risk of serious harm, emergency treatment may proceed under the doctrine of implied consent or necessity. But this must be documented meticulously and re-evaluated as soon as possible. The ENA Code of Ethics and state-specific statutes on emergency care and consent provide the guiding principles for such complex situations. Question 15. The evaluation methodology shows that in a patient presenting with a significant mechanism of injury and altered mental status, which of the following initial nursing actions best reflects the priority of care for potential head and spinal cord injuries? Option A. Focus on assessing pupillary response and cranial nerve function to determine the extent of the head injury. Option B. Administer oxygen and prepare for immediate intubation if airway is compromised, while maintaining strict cervical spine immobilization. Option C. Begin a detailed history taking from the patient and any accompanying witnesses to understand the event. Option D. Aggressively reposition the patient to facilitate a thorough physical examination of all body systems. The correct answer is B. Administer oxygen and prepare for immediate intubation if airway is compromised, while maintaining strict cervical spine immobilization. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in emergency nursing, rapidly assessing a patient with a potential head and spinal cord injury. The core difficulty lies in the need to balance immediate life-saving interventions with the imperative to avoid exacerbating a potential spinal cord injury. The patient's altered mental status and mechanism of injury necessitate a high index of suspicion, demanding a systematic and cautious approach. The challenge is amplified by the potential for rapid deterioration and the need for precise, evidence-based interventions within a high-pressure environment. Correct approach analysis. The correct approach prioritizes the ABCs: airway, breathing, circulation, while maintaining cervical spine immobilization. This aligns with established emergency nursing protocols and guidelines, such as those promoted by the Emergency Nurses Association (ENA) and relevant National Emergency Medical Services (EMS) standards. Maintaining a patent airway is paramount, as hypoxia can rapidly worsen neurological outcomes. Gentle suctioning, If necessary, an airway adjunct should be employed without hyperextending or flexing the neck. Spinal immobilization, typically with a cervical collar and backboard, is crucial to prevent further damage to the spinal cord. Neurological assessment, including Glasgow Coma Scale (GCS) and pupillary response, should be performed promptly and documented, but not at the expense of airway management or spinal precautions. This systematic, prioritized approach ensures that life-threatening conditions are addressed first while minimizing the risk of iatrogenic injury. Incorrect approach is analysis. One incorrect approach involves immediately attempting to elicit a detailed history from the patient or bystanders before ensuring airway patency and spinal stability. This violates the fundamental principle of prioritizing life support. Delaying airway management in favor of history taking can lead to hypoxia and irreversible brain damage, a direct ethical and regulatory failure to provide appropriate care. Another incorrect approach is to aggressively reposition the patient to facilitate examination or obtain better visualization without adequate spinal precautions. This action directly contravenes guidelines for suspected spinal cord injury and carries a significant risk of causing or worsening neurological deficits, representing a breach of professional duty of care and potentially violating patient safety regulations. A third incorrect approach is to focus solely on the head injury symptoms, such as pupil dilation, without concurrently addressing potential spinal cord compromise. While head injuries are critical, neglecting the spine in a trauma patient with a significant mechanism of injury is a failure to conduct a comprehensive assessment and can lead to catastrophic outcomes, violating standards of care for multisystem trauma. Professional reasoning. Emergency nurses should employ a structured decision-making framework based on the principles of trauma care. This begins with a rapid primary survey of airway, breathing, circulation, disability, exposure to identify and manage immediate life threats. For suspected head and spinal cord injuries, the disability component, which includes neurological assessment, is integrated with the exposure to ensure the entire body is assessed for injuries while maintaining spinal precautions. Continuous reassessment is vital. When faced with uncertainty, always err on the side of caution, assuming a spinal cord injury until proven otherwise. Adherence to established protocols, continuous education, and teamwork with other healthcare professionals are essential for optimal patient outcomes. Question 16. Investigation of a patient presenting to the emergency department with vague abdominal discomfort and a history of recent travel. What is the most appropriate initial nursing approach to risk assessment? Option A. Ask the patient to describe their symptoms and rely solely on their self-reported level of pain to guide further actions. Option B. Provide immediate pain relief and reassurance, deferring a detailed assessment until the patient reports increased discomfort. Option C. Delegate the initial assessment and risk stratification to a nursing assistant to free up registered nurse time for more acute cases. Option D. Conduct a thorough history and physical examination, including specific questions about travel-related symptoms and potential exposures, and initiate appropriate diagnostic investigations based on findings. The correct answer is D. Conduct a thorough history and physical examination, including specific questions about travel-related symptoms and potential exposures, and initiate appropriate diagnostic investigations based on findings. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent unpredictability of emergency department presentations and the critical need for rapid, accurate risk assessment. The emergency nurse must balance immediate patient needs with the potential for delayed or misdiagnosis, all within a high-pressure environment. Effective judgment is required to prioritize interventions and allocate resources appropriately, ensuring patient safety while adhering to professional standards. Correct approach analysis. The correct approach represents best professional practice because it aligns with the core principles of emergency nursing and established regulatory frameworks, such as those governing nursing scope of practice and patient assessment. Specifically, it emphasizes a systematic, evidence-based approach to risk assessment, which is a fundamental competency for emergency nurses. This involves gathering comprehensive data, utilizing critical thinking skills to identify potential risks, and implementing appropriate interventions based on the assessed level of risk. This proactive approach minimizes the likelihood of adverse events and ensures that patients receive timely and appropriate care, fulfilling the nurse's ethical and legal obligations to provide safe and effective care. Incorrect approach is analysis, an approach that relies solely on patient self-reporting without independent verification or further assessment, fails to meet the standard of care. This is a regulatory and ethical failure because it neglects the nurse's professional responsibility to conduct a thorough assessment and identify potential risks that a patient may not be aware of or able to articulate. It can lead to misdiagnoses and delayed treatment, violating the duty of care. An approach that prioritizes the comfort of the patient over a comprehensive risk assessment, such as offering only palliative measures without a full diagnostic workup, is also a failure. This is ethically problematic as it may constitute abandonment or a failure to provide necessary medical intervention. From a regulatory standpoint, it breaches the expectation that nurses will advocate for their patients and ensure they receive appropriate medical evaluation and treatment, regardless of perceived severity by the patient. An approach that delegates the primary risk assessment to a less experienced or unqualified individual without direct supervision or validation by the registered nurse is a significant regulatory and ethical breach. This violates professional accountability, and the principle of competent practice can lead to errors in judgment and potentially compromise patient safety, as the ultimate responsibility for patient care rests with the licensed registered nurse. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, incorporating subjective and objective data. This data is then analyzed using critical thinking and clinical judgment to identify potential risks and prioritize care. The nurse must continuously reevaluate the patient's condition and adjust the plan of care accordingly. Adherence to established protocols, guidelines, and the nursing process is paramount. Collaboration with the healthcare team and clear, concise documentation are essential components of this process. Question 17. Process analysis reveals that a patient presents to the emergency department following a fall from a significant height. The patient is conscious and denies immediate pain, but there are no obvious external signs of injury. Which of the following nursing actions best demonstrates an understanding of the mechanism of injury and its implications for patient care within the regulatory framework for emergency nursing? Option A. Documenting the patient's statement of no pain and preparing for discharge once vital signs are stable. Option B. Administering pain medication and observing the patient for the development of symptoms. Option C. Initiating a rapid head-to-toe assessment, focusing on potential internal injuries and requesting advanced imaging based on the mechanism of injury. Option D. Providing reassurance to the patient and family that no significant injuries are likely given the absence of visible trauma. The correct answer is B. Administering pain medication and observing the patient for the development of symptoms. Explanation. This scenario is professionally challenging due to the inherent unpredictability of emergency situations and the critical need for accurate assessment of mechanisms of injury to guide immediate interventions and anticipate potential complications. The certified emergency nurse, CEN, must apply a systematic approach to patient assessment, prioritizing actions based on established protocols and evidence-based practice, all within the regulatory framework governing emergency nursing in the specified jurisdiction. The correct approach represents best professional practice because it aligns with the CEN's responsibility to conduct a thorough and systematic assessment. Understanding the mechanism of injury is paramount for predicting internal injuries, even in the absence of obvious external signs. This proactive approach allows for targeted diagnostic testing and early intervention, minimizing the risk of delayed diagnosis and adverse outcomes. Adherence to established emergency nursing standards of care, as mandated by professional organizations and regulatory bodies within the jurisdiction, dictates this comprehensive assessment strategy. An incorrect approach that focuses solely on visible trauma without considering the mechanism of injury fails to meet the standard of care. This oversight can lead to missed internal injuries, such as organ damage or internal bleeding, which may not be immediately apparent. Ethically, this constitutes a failure to provide competent care and uphold the patient's right to an accurate and timely assessment. From a regulatory perspective, it violates the principles of safe and effective nursing practice, potentially leading to disciplinary action if patient harm results. Another incorrect approach that relies on assumptions about the patient's condition without a systematic assessment is equally problematic. Emergency nursing requires a data-driven approach. Making assumptions bypasses the critical step of gathering objective information, which is essential for developing an appropriate care plan. This can lead to inappropriate interventions or a lack of necessary interventions, both of which are regulatory and ethical failures. The professional decision-making process for similar situations involves a structured approach. 1. Recognize the situation and potential hazards. 2. Gather information, including the mechanism of injury, patient history, and vital signs. 3. Analyze the information to identify actual and potential problems. 4. Plan interventions based on established protocols and best practices. 5. Implement the plan, continuously reassessing the patient's response. 6. Evaluate the effectiveness of interventions and modify the plan as needed. This iterative process ensures that care is patient-centered, evidence-based, and compliant with all relevant regulations and ethical standards. Question 18. Compliance review shows that an emergency department is experiencing a surge in patient arrivals. A nurse is tasked with triaging 5 patients simultaneously: a child with a high fever and lethargy, an elderly individual with chest pain and shortness of breath, a young adult with a minor laceration, an individual complaining of abdominal pain with a rigid abdomen, and a patient who is conscious but disoriented with a history of head trauma. Which approach best aligns with established triage systems and protocols for this scenario? Option A. Assess the patient with the laceration first to quickly clear them from the waiting area, then address the child with fever, followed by the disoriented patient, the abdominal pain patient, and lastly the chest pain patient. Option B. Triage based on the order of arrival, ensuring each patient receives a brief initial assessment before moving to the next in line, regardless of presenting symptoms. Option C. Prioritize the patient with chest pain and shortness of breath due to the potential for immediate cardiac compromise, followed by the individual with abdominal pain and a rigid abdomen, then the disoriented patient with head trauma, the child with fever and lethargy, and finally the patient with the laceration. Option D. Focus initial assessment on the patient with the most dramatic presentation, regardless of underlying acuity, to manage perceived urgency. The correct answer is C. Prioritize the patient with chest pain and shortness of breath due to the potential for immediate cardiac compromise, followed by the individual with abdominal pain and a rigid abdomen, then the disoriented patient with head trauma, the child with fever and lethargy, and finally the patient with the laceration. Explanation. Scenario analysis. This scenario presents a common challenge in emergency nursing: rapidly assessing and prioritizing multiple patients with potentially life-threatening conditions. The difficulty lies in accurately applying triage principles under pressure, ensuring that the most critically ill receive immediate attention while others are managed appropriately based on their acuity. Misapplication of triage can lead to delayed care for those in greatest need, potentially resulting in adverse outcomes and violating professional standards of care. Correct approach analysis. The correct approach involves a systematic and evidence-based application of the established triage system. This aligns with regulatory requirements for emergency departments to have standardized protocols for patient assessment and prioritization. Best professional practice dictates adherence to these protocols to ensure equitable and efficient care delivery, minimizing the risk of harm and maximizing the potential for positive patient outcomes. This approach reflects a commitment to patient safety and adherence to the principles of emergency nursing as outlined in professional guidelines and regulatory frameworks. Incorrect approaches analysis. An approach that prioritizes patients based on perceived social status or ability to pay is a direct violation of ethical principles and regulatory mandates that prohibit discrimination in healthcare. This constitutes a failure to provide care based on medical need, which is a cornerstone of emergency services. An approach that delays assessment of a patient with obvious signs of distress because they arrived by private vehicle, assuming they are less critical, is a failure to adhere to objective triage criteria. This demonstrates a bias that can lead to misclassification and delayed treatment for a patient who may be deteriorating rapidly. An approach that focuses solely on the patient's chief complaint, without a comprehensive rapid assessment of vital signs and overall presentation, can lead to overlooking subtle but critical signs of deterioration, thus misclassifying their acuity and potentially delaying life-saving interventions. This deviates from the systematic assessment required by established triage protocols. Professional reasoning. Emergency nurses must employ a structured decision-making process that begins with a thorough understanding of the facility's approved triage system and protocols. This involves continuous education and competency validation in triage. When faced with multiple patients, the nurse should perform a rapid, systematic assessment of each, focusing on ABCs, airway, breathing, circulation, and other critical indicators of acuity. Documentation of the triage decision and rationale is crucial for accountability and continuity of care. If uncertainty exists, consulting with a charge nurse or physician is a vital step in ensuring appropriate patient management. Question 19. Operational review demonstrates a need to refine emergency department protocols for pediatric patients. Specifically, the review highlights instances where initial assessments of young children presenting with respiratory distress may have been less effective than desired. Considering the unique physiological and psychological differences in pediatric patients compared to adults, which of the following approaches best reflects current best practices for initiating a pediatric emergency assessment? Option A. Begin with a rapid head-to-toe assessment, observing for general appearance, work of breathing, and skin color, while simultaneously gathering a brief history from the caregiver, and then proceed to more detailed assessments based on initial findings. Option B. Immediately administer oxygen and initiate intravenous access while awaiting further diagnostic information, as this is the standard protocol for all patients with respiratory distress. Option C. Conduct a thorough, systematic head-to-toe assessment as one would for an adult, ensuring all anatomical structures are examined in detail before considering the child's overall presentation or caregiver input. Option D. Focus primarily on obtaining a detailed medical history from the parents or guardians, as they are the most reliable source of information regarding the child's condition. The correct answer is A. Begin with a rapid head-to-toe assessment, observing for general appearance, work of breathing, and skin color, while simultaneously gathering a brief history from the caregiver, and then proceed to more detailed assessments based on initial findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the emergency nurse to adapt standard assessment techniques to a pediatric patient, recognizing that physiological and psychological differences necessitate a modified approach. Failure to do so can lead to misinterpretation of vital signs, delayed diagnosis, and inappropriate interventions, all of which carry significant ethical and professional implications. The nurse must balance the urgency of the emergency with the need for a gentle, age-appropriate assessment to gain cooperation and accurate data. Correct approach analysis. The correct approach prioritizes a systematic head-to-toe assessment while incorporating age-specific considerations. This aligns with best professional practice as outlined by nursing standards and emergency care guidelines, which emphasize patient-centered care and evidence-based practice. For pediatric patients, this means observing for signs of distress that may not be immediately apparent in adults, such as changes in playfulness, interaction, or feeding. It also involves using age-appropriate language and techniques to minimize fear and anxiety, thereby improving the reliability of the assessment. This approach upholds the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approaches analysis. One incorrect approach involves applying adult assessment protocols without modification. This fails to acknowledge the unique developmental stages and physiological responses of children. For instance, a normal respiratory rate for an adult might indicate significant distress in an infant. This approach risks misinterpreting critical data, leading to delayed or incorrect treatment, which violates the duty of care and professional standards. Another incorrect approach is to solely rely on parental reporting without direct assessment of the child. While parental input is valuable, it cannot replace a comprehensive nursing assessment. The nurse has a professional and ethical obligation to gather objective data directly from the patient, as parents may not always recognize subtle signs of deterioration or may be overwhelmed by the situation. This failure to perform a direct assessment can lead to misdiagnoses and compromised patient safety, a breach of professional responsibility. A third incorrect approach is to rush the assessment without establishing rapport or considering the child's comfort. This can result in a combative or uncooperative child, leading to an incomplete and inaccurate assessment. It also disregards the psychological impact of the emergency department environment on children, potentially exacerbating their distress and hindering effective care. This approach is ethically unsound, as it fails to treat the child with dignity and respect, and professionally deficient, as it compromises the quality of care. Professional reasoning. When assessing a pediatric patient in an emergency setting, the professional decision-making process should begin with recognizing the need for a modified approach compared to adult patients. The nurse should then systematically consider the child's age, developmental stage, and presenting symptoms, prioritizing non-invasive observations and interventions, while gradually progressing to more intrusive assessments as needed, is crucial. Establishing rapport with both the child and their caregivers is paramount. The nurse should continuously reassess the child's condition, adapting the assessment strategy as the situation evolves. This iterative process ensures that care is both effective and compassionate, adhering to the highest professional and ethical standards. Question 20. The analysis reveals that a critically injured patient arrives with multiple potential traumas. Which of the following nursing approaches best aligns with the certified emergency nurse's responsibilities in managing this complex situation, prioritizing patient outcomes and adherence to regulatory frameworks? Option A. Rely on personal experience and intuition to guide the assessment and treatment plan, intervening based on what appears to be the most critical issue at that moment, without strictly adhering to a standardized trauma protocol. Option B. Delay essential resuscitation efforts to gather a comprehensive pre-hospital report and detailed patient history from arriving paramedics and family members to ensure all potential contributing factors are understood. Option C. Conduct a rapid, focused assessment of the most obvious injury. Initiate immediate interventions for that specific problem, and then proceed with a more detailed assessment once the patient is stabilized. Option D. Prioritize immediate life-saving interventions based on the ABDE approach, perform a systematic head-to-toe secondary survey, and continuously reassess the patient's condition while documenting all findings and interventions. Correct answer is C. Conduct a rapid, focused assessment of the most obvious injury, initiate immediate interventions for that specific problem, and then proceed with a more detailed assessment once the patient is stabilized. Explanation. This scenario is professionally challenging due to the inherent complexity of trauma care, which demands rapid, evidence-based decision-making under extreme pressure. The nurse must balance immediate patient needs with the need for accurate documentation and communication, all while adhering to established protocols and ethical obligations. The patient's deteriorating condition and the presence of multiple potential injuries necessitate a systematic and thorough approach to assessment and intervention. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the established standards of care for trauma patients. This involves a comprehensive primary and secondary survey, prompt initiation of resuscitation measures based on the ABDE approach, airway, breathing, circulation, disability, exposure, and continuous reassessment. This aligns with the principles of emergency nursing as outlined by professional organizations and regulatory bodies, emphasizing a systematic, patient-centered approach to trauma management. It ensures that critical interventions are not missed and that the patient receives timely and appropriate care according to evidence-based guidelines. An incorrect approach that focuses solely on managing one obvious injury without a systematic head-to-toe assessment fails to recognize the potential for occult injuries, which is a common pitfall in trauma. This could lead to delayed diagnosis and treatment of life-threatening conditions, violating the ethical duty to provide comprehensive care and potentially breaching standards of practice. Another incorrect approach that delays essential interventions to gather extensive patient history from family before initiating resuscitation overlooks the critical nature of immediate life-saving measures in trauma. While obtaining history is important, it should not supersede the urgent need for airway management, breathing support, or circulation restoration, as dictated by the ABDE assessment. This failure to prioritize life-saving interventions constitutes a significant ethical and professional lapse. An approach that relies on intuition or anecdotal experience without applying standardized trauma protocols risks inconsistent and potentially harmful care, deviating from the evidence-based practice expected in emergency nursing and potentially violating regulatory requirements for competent care. Professionals should employ a structured decision-making process that begins with a rapid assessment using a recognized trauma protocol, e.g., ADL's principles. This involves a systematic primary survey to identify and manage immediate life threats, followed by a secondary survey to gather more detailed information and identify other injuries. Continuous reassessment is crucial, and interventions should be guided by the patient's physiological response and the findings of the ongoing assessment. Effective communication with the trauma team and clear, concise documentation are integral throughout the process.